Hi, welcome back. Now, we will be talking about the assessment and investigations for a case of delirium. So, how do we assess a patient who we suspect might have delirium? It is through a thorough history taking, physical examination, investigation, and assessment tools. We will go through each one of these for this session, except for assessment tools, which will be discussed in the next coming session. Assessment to determine the cause or causes of delirium starts with history from collateral information, history regarding patient premorbidly or during the starting period of medical illness. Second is a complete physical examination. Third is special attention to conditions and treatments, including medications that might be contributing to delirium. Fourth is routine investigations should be conducted. Careful history and complete physical examinations are very important. And this is one of the most important assessments during delirium. In historical information required during initial assessment of a delirious patient, it is important to know the known medical conditions, whether it's acute or chronic. It is important to take note of recent surgeries, full drug history including non-prescription drugs, thorough history of current patterns of alcohol and other substance uses, previous cognitive functioning, functional abilities, basic and instrumental activities of daily living, onset and cause of client's delirium, history of any previous episodes of delirium and its treatment responses, other current psychiatric disorders and symptoms, psychosocial history, symptoms suggestive of underlying cause or precipitant such as infection, sensory deficits and presence or use of any sensory aid such as hearing aid or glasses, elimination patterns, and sleep patterns. As you can see, the historical information needs a very good collateral contribute or informant from family or spouses or close friends for the primary team to find out about patient. It is important to know regarding modifiable and environmental factors potentially contributing to the occurrence or severity of delirium. These include sensory deprivation, windowless room, single room, sensory overload, where there's too much noise and activity, isolation from family or friends, frequent room changes, absence of orientating devices such as watch or clock, or calendar. Any absence of visual or hearing aids may also be potential cause contributing to delirium, and the use of restraints, particularly physical restraints. Common potential causes of delirium include drug-induced, alcohol and drug withdrawal, post-operative delirium, infectious causes, fluid electrolyte disturbance, metabolic endocrine, cardiopulmonary, hypoperfusion or hypoxia, intracranial, sensory or environmental. Moving towards physical examination, during the initial assessment of the delirious patient, a complete physical examination should be conducted. The following components of the physical examination which require more emphasis include neurological examination, including level of consciousness, neurocognitive function, using a standardized instrument such as mini mental state examination, hydration and nutritional status, evidence of sepsis, such as fever, potential source, such as pneumonia if present, evidence of alcohol abuse, such as stigmata of chronic alcohol abuse, or withdrawal symptoms such as tremor. Investigations usually indicated in persons with delirium include complete blood count, biochemistry such as calcium, albumin, magnesium, phosphate, creatinine, urea electrolytes, liver function tests and glucose, thyroid function tests, blood culture, oxygen saturation or arterial blood gases, urinalysis, chest X-ray and ECG. Investigations usually indicated in persons with delirium, as mentioned earlier, and also review old and new anticholinergic medications, brain imaging or more invasive diagnostic tests for delirium assessment may not be indicated without the presence of positive findings during history, physical examination, or review. Interprofessional assessment is a must. Review old and new sedating medications. Review the need for Foley catheters, IV lines, and other tethers. Apply glasses, insert hearing aids. These are important assessment for patient. Thank you for your attention. We will continue with the next topic, which is assessment tool. See you.